Good afternoon, everybody. This is Jim Shames. I'm the health officer for Jackson County. And the focus of today's press conference is going to be how to prevent the spread of virus in our community. And I want to share with you what I think you need to know today. So, there are 5 new cases of COVID-19 in the state of Oregon in the last 24 hours. We have 1 case in Multnomah County, 1 case in Polk, Marion, Umatilla, and Deschutes. And there were no known travel risks that we're aware of. That is to say that it looks as if these cases represent community spread of COVID-19. That brings us to a total of 19 known cases in the state. We have 67 people under monitoring and 232 people under monitoring and 67 people under investigation for the virus. If you look a little further out, Washington State has 267 cases with 105 new cases in the last 24 hours. California, 152 cases with 17 new cases in the last day. And then, of course, we have cases in the majority of other states around the country. I think it's useful, perhaps, to look at what's happening internationally. There's some lessons learned for us. For example, although China continues to have most of the cases in the world, 99% of all new cases reported in the last 24 hours have come from outside of China. South Korea, Italy, Iran, France, Germany, and Spain are all countries with significant spread of the coronavirus. We have 113,702 known cases worldwide with over 4,000 deaths. So I would like to discuss a little bit about some cases internationally and what we've learned. So, for example, when this disease first broke out, it occurred in Hubei, China, and the mortality rate was very high, about 4.5%. After China started instituting various measures to control the disease from a public health perspective, the mortality rate dropped to 0.9%. South Korea, which has been very aggressive, although they have lots of cases, their mortality rate is 0.7%. In the U.S., it's currently around 4%. So what I'm going to be talking about now is what we can do and what we should look forward to doing to try and get a handle on this, keeping in mind that other countries have done things that have been very effective, and we may find ourselves wanting to do some of the same things. So there's some things we've learned about the course of the disease. We're learning every day because things are changing. And one of those is how infectious the disease is and how people catch it. So we continue to compare this to the influenza, but there are some significant differences. So one comparison that's useful is when people start getting sick with the flu, they're highly contagious. Often further on in the disease, they may be less contagious. This seems to be the same, so that early, very early, sometimes even before people know they have symptoms, they are able to pass the disease on to others. The other thing to be aware of is that they may not be coughing for days, so that means the source of the infection is probably coming from their mouth and their throat. So we'll be discussing later a reminder of strategies that we can all do to prevent passing the disease on, but touching our mouths and touching objects is one way that it can be spread, and the evidence is suggesting that that's especially important. The other thing is that we need to separate the concepts of panic and preparedness. So we're going to be asking the public to do many things to prepare, both in their own lives and perhaps even from a societal basis. No reason to panic. These are proven things that may change people's lives, but have real science behind them. So the best way to prevent community spread is to spread the community. So that has to do with social distancing. We have a lot of things we take for granted: shaking hands when you meet people, hugging people when we meet them, getting together for a group selfie, and those are behaviors that really are putting us at risk. And I would suggest that, among other things, we need to look at our lives and things we do that that we can change to increase social distancing. The other thing has to do with when we congregate and where we congregate. We're not recommending the disbanding of all mass gatherings at this point. There are some places like Washington State that have started to make those changes. But I do think it's time for us to think about whether or not you want to go to a gathering. If you are in a high-risk group, you're elderly, you have chronic disease, you may choose not to take that flight, go on that vacation, or attend that meeting. And if you're in charge of setting something like that up, you should probably look at ways in which you could change the structure of what you do to increase social distancing and keep people safer. So the reason we want to do all that is not necessarily to totally prevent the disease from entering our community. And I have a map here. Can you all see that? Okay. And let me see if I can step around and you can still hear me. If we did nothing and a brand new disease like COVID-19 came into our community, we would expect this red line to be the way it would spread throughout our community. That is, the disease would increase very rapidly. There would come to a point at which we would run the risk of overwhelming all of our systems. That is, the hospitals would be overwhelmed, the ambulance services would be overwhelmed, and we wouldn't be able to function, and we would probably lose lives because of that. What we're trying to do in public health is to create this blue line, which doesn't say that there will be no disease in our community. It says that it's going to ramp up slowly, and it will never get to the point where we can't handle it. So the things I'm going to go over with you are to try and achieve what you see on the blue graph, as opposed to what could happen if we did nothing and we were overwhelmed. So, first thing to do, remember who's at most risk. It's the elderly, those with chronic diseases, and we need to inform ourselves of what we can do to keep them safe. So, as I said earlier, a large amount of this virus seems to be spread from someone's mouth to someone else, and it can occur before people know they're even sick. So therefore, you want to avoid unnecessary contact with others. Wash your hands thoroughly and often. We need to stop touching our faces, and I can't remember if I've done it this time, but I'm trying. Especially touching your mouth and then touching another object or touching someone else. Isolate yourself as soon as you feel ill. Cover your mouth when you're sick and you're out in public. So if you have a cough or you're feeling ill and you have to be around other people, putting a mask on or a bandana on or something to prevent the droplets from leaving your mouth is what you should be doing. We want to avoid overwhelming our healthcare system. So if you're feeling sick and you think you can weather this at home, you should do so. Even if you think you have COVID-19, in order to get tested, that means you're going to leave the house, means you're going to go to a healthcare system. We have no vaccine, we have no medication for this, so we want people to treat themselves at home, help their loved ones. If you are overwhelmed, call your healthcare system ahead of time, call your doctor, call your nurse practitioner, or call 911, but let them know what you have, and they can help direct you to get the most appropriate care and keep themselves safe. It might be helpful to start thinking about what the economic impacts would be on your own lives. Sort of have contingency planning in case you have to stay home from work and you can't telecommute, or your children have to be home from school and you can't go to work that way. It's really important to get information that you trust. There's a lot of disinformation out there. People are confused and concerned. The Oregon Health Authority, the CDC, the World Health Organization, the Jackson County website all have reputable information. It's easily accessible, right? For example, 27 people died of methanol poisoning in Iran when rumors said that drinking alcohol will help cure the disease. And I've heard of people drinking bleach thinking it was going to cure the disease. So if in doubt, go to a reputable site and find out what the facts really are. We need to stay informed to protect those most in need. And it's going to be challenging to take care of people who need assistance. But I think if we plan ahead and think about how you're going to keep your hands clean, how to avoid contact with the other person, we can do this. And I'm sure that our humanity will get us through this. Any questions?
I do have one. You said elderly are most susceptible, children are least susceptible. What about babies?
It doesn't look like babies are at significant risk.
Can you tell us what the duration for a healthy individual is on average for this?
Right. So the duration of illness varies by age. So if I'm remembering the numbers correctly, I think the average duration of sickness for someone perhaps over the age of 60 might be a month. However, it does not look as if people are particularly contagious after about 6 days. I'm sorry, 10 days. So the infectivity is highest at the beginning of the illness. It probably is minimal after 10 days. That doesn't mean that people are better after 10 days. They can be ill for quite some time.
What if someone thought they had the flu, and with all this information coming out, now they think they may have had the coronavirus? What should they do? Should they consult their doctor, or is it just kind of too late?
The treatment is symptomatic treatment. That is, we have no specific treatment for this disease. So certainly if you were fortunate enough to get it, be over with it, you are probably protected from it coming back, and there's no reason you would need to have further diagnostic tests.
The CDC has talked about smokers being more at risk. Have local health and federal addressed, vaping and how that might influence people being more at risk?
Yeah. Smokers do not have healthy lungs by and large, and this is a lower respiratory infection that affects the lungs. So smokers are at risk. People who live with polluted air are at risk. So I would say that generally speaking, if you are a heavy smoker, you're a heavy vapor, and then you are probably at greater risk of having serious consequences from this disease.
A lot of people have had a lot of questions regarding travel.
Yes.
And just kind of getting out and coming in. Are the people that are traveling other places coming through, the airport, are they being monitored at all?
The CDC has guidelines and stratifies different countries depending on the risk, and the high-risk countries I believe are still being funneled through specific airports where they can be screened. The further we get into this, the least consequential that impact is. For example, all of the 5 new cases we had in the state in the last 24 hours had no history of international travel. So we're at the stage now where it looks like community spread is primarily what we're dealing with.
You mentioned places with high pollution. Would that include here we get pretty smoky? Would that fall under that category? Would that put us at higher risk?
It's pretty hard to find a place in the world where there isn't some particulate matter, and those things do affect our breathing. But I think the bottom line is the clearer your lungs are, the healthier they are, the easier it's going to be for you to fight off an infection. I think we all should be concerned about the quality of our air, but I don't think we have particularly dangerous air. If we were battling coronavirus in the middle of some of the worst air days we've had with the wildfires, that would probably be a confounding variable.
With events like Feed the Homeless going on and things like that, are there any recommendations? I know you talked about during the last press conference working with organizations that do that type of thing, that
Right.
cater to vulnerable individuals. Can you talk about what the specific recommendations are for events like that?
So guidelines are being developed for really everybody who has contact with the public. Some of the things that are being done right now with the Feed the Homeless would be to have people clean their hands as soon as they enter the facility, to minimize their touching so that they can be given a napkin with utensils in it instead of going through the utensil drawer, instead of grabbing for a cup and getting their own coffee, to have it given to them, more spacing between everyone, and that is already being enacted.
I think we've touched on this before, but it's been said even by our vice president that the masks don't necessarily protect you. Can you explain again why that is?
Sure. So this is a droplet spread disease, and droplets generally go as far as 6 feet away from a person, and then they fall to the ground. If I'm coughing, it's fairly easy for me to prevent the spread if I just have something to cover my mouth, or if I cough into a tissue or cough into the crook of my arm. If I'm walking around in the street or I'm going shopping and I'm wearing a mask, it's possible, but it's unlikely that exact moment I'm going to be protected from some droplet, because it doesn't just float in the air. There are conditions where infectious material does float in the air great distances. This is not one of them, and therefore certainly a simple mask, and not even an N95 mask, is likely to help you much, and we have no data to suggest that it helps you at all. But there are circumstances where the masks are needed, so if the public could save those masks, to make sure that when it's needed and who needs them has enough, that would be useful.
I know a lot of local schools, people are asking, elementary schools, high schools, even the colleges around here. I'm sure you're in contact with them. Are they changing any way they're going about?
There's a number of schools of higher education that have suspended classes and are teaching remotely. I'm not aware of any schools locally doing that. A number of schools are looking at mass gatherings within the school to try and limit those, certainly ones that occur indoors. And, I think there's some validity to that. The controversy has to do with K-12 and whether or not it's appropriate to close schools, and if so, when and for how long. The issues are that children don't get very ill from this. It's a little unclear how much children actually get the disease, and then how disruptive it is to close schools. So is that a very effective strategy? Are there more effective strategies that might be a little less impactful you could do first? We are weighing that. We're talking to our public health colleagues and looking for guidance. So it would be an individually based decision.
With WHO announcing a pandemic with this today, are there any changes in the way the county is approaching coronavirus at this point?
I think the county's been approaching this as if it were a pandemic or a potential pandemic. I don't think it really changes much. We're looking for information on the ground, and we're preparing for various strategies if it should get worse or stay the same.
And then the latest too, with it being on the surface potentially for 3 days. I know you discussed that a little bit yesterday. Does that change anything as well? The latest studies are saying it can potentially be on a surface for 3 days.
Yeah, to get definitive data about that, it would take the kinds of studies we just haven't done yet, and we're really kind of extrapolating from what we know of other similar viruses. The latest I heard that makes sense to me is maybe 1 to 4 hours. but for safety's sake, we're saying, you should assume surfaces could be contaminated longer. And the good news is that most any disinfecting material will kill the virus.
I'm good.
Any other questions? No? Okay, thank you guys.
Thank you.